Good afternoon, friends. I'm going to talk today about lipids in general, the importance of statins in lowering LDL cholesterol, but more importantly, what can we do beyond that, and the importance of PCSK9 inhibitors in practice. As you're well aware, PCSK9 inhibitors have now been available for the last year or year and a half. We know that they're injectable, we know that they're expensive, but however, they have a very important role to play. As I will show you how important it is that in a large group of patients that we have, controlling of LDL is very important. So let's go through over the next half an hour or so about aspect of lipid treatment. One fact that we know for a long time now is that lower the LDL cholesterol, there's a reduction of ischemic events. Now, whether you have a genetic problem such as familial hypercholesterolemia or you have non-familial LDL rise, you can see from these trials, whether done genetically lowered or whether that lowered pharmacologically, that as you lower your cholesterol down, there is a reduction of cardiovascular events. So clearly, there is no doubt over a long period of time now that LDL cholesterol is the harmful cholesterol, and that lowering the LDL cholesterol will produce significant benefits. We also know that statins are very useful. We have been using statins for a couple of decades now, but we also know that statins have a couple of problems. First is that they produce some amount of symptoms. They produce myopathy, which is sometimes troubling, though it's not really a major problem, and any serious consequences of muscle disorders due to statins are extremely rare. The second problem is that there is a situation of true statin intolerance, where some people really cannot tolerate statins at all. Then of course is the issue that statins do not bring the cholesterol down to as lower levels as we want. So that in spite of reducing the LDL with statins, there is still a significant residual risk that remains. So we are using statins, people are, even those who tolerate and even those who take maximum doses of statins, sometimes do not achieve the low levels of LDL that are now desired. And I'll tell you in the later slides as to what the recent guidelines suggest should be low levels of LDL cholesterol. Now you can see from this slide as well that data, whether you look at USA or UK or India, you find that there is a cardiovascular risk reduction which has been going on, and partly it is related to benefits in terms of general health in cardiovascular, the lifestyle changes, but still a huge amount of patients still continue to have cardiovascular disease. Some data from India, as you can see, between 2000 and 2018, there is a significant 2015 where we have the last data, there's almost doubling the number of patients with coronary artery disease. As you all know, in India we get coronary artery disease much earlier, and we have a lot of diabetes and hypertension, and therefore we need to be even more aggressive with our lipid-lowering agent. Now before you give statins, obviously all of us are going to, before you give PCSK9 inhibitors, we are all going to obviously use statins as the first drug. Now what are the issues related to statins? I must talk about that first. Now statins have a number of problems, though none of them are really very serious, except in maybe less than 1%. One, hemorrhagic stroke. It's clearly been shown that it does not increase hemorrhagic stroke in the general population who takes it, but there's some little data to suggest that those who had previous strokes, especially hemorrhagic strokes, there might be an increase of stroke. But I'll show you later on that this is extremely rare. Okay, there's a question, is it convenient for poor patients? Cost is always an issue. I mean, we could discuss about cost for everything. Cost is an issue. If a patient cannot afford it, I mean, there's very little that we can do about it. Yes, you can speak to the company, they'll give some amount of concession, so that's one thing you can do. Number two, you can take it once in 4 weeks instead of 1-2 weeks, though that's not officially recommended, and that's not a recommendation I'm giving you. It's just a practical point for those who can't afford. But you know, you must remember that when the patient has a heart attack, he's going to go to the hospital, he's going to spend for that, he's going to have a stent, he's going to have an angioplasty or a bypass surgery. It's everything is expensive, unless you say don't do anything and just let him be. So convenience is good and patients are poor, I understand that, but you know, heart disease is a problem, and treatment of heart disease is also a problem. So why not try and prevent it rather than having a problem which will be much more expensive to deal with? what is the treatment for isolated triglycerides? Dr. Kaushal. Kaushal, the treatment for triglycerides, the present recommendation is that when triglycerides are more than 200, that they do produce some harm and that they should be treated. There's a lot of controversy about triglycerides. We all know that if it's more than 500, you get pancreatitis and you need to treat. There's a lot of data now that even triglycerides between say 200, 250 to 300, 400 is harmful, and that we should treat these triglycerides. The Lipid Guidelines of India Association have also suggested that we treat triglycerides, and this is particularly important for India. The reason is that Indians, unlike the West, don't have this dramatically high LDLs. They have very moderate LDL elevation. They have high triglycerides and low HDL. As you know, all the trials with HDL rise did not show any benefit, so we have stopped using niacin and other drugs. We know that we must keep the LDL down, but I would strongly also recommend that we keep the triglycerides down, either with fenofibrate or whichever other drug that you want. So any patient who's got an LDL above at least 250, I would treat. Some of the guidelines suggest any value about 204 of triglycerides should be treated. So yes, elevated triglycerides should not be ignored and should be treated.